Leukemia is a type of cancer that affects the blood cells, especially the white blood cells that are responsible for fighting infections. Leukemia occurs when the bone marrow, the soft tissue inside the bones where blood cells are made, produces abnormal WBCs that do not function properly and crowd out the normal blood cells. Leukemia can be classified into 4 main types, based on the speed of progression and the type of blood cell involved. Acute lymphocytic leukemia. This is the most common type of leukemia in children, but it can also affect adults. It involves immature lymphocytes, a type of WBC, that multiply rapidly and interfere with the production of other blood cells. Chronic lymphocytic leukemia. This is the most common type of leukemia in adults, especially older adults. It involves mature lymphocytes that accumulate slowly in the blood and bone marrow and may not cause symptoms for years. Acute myeloid leukemia. This type of leukemia can affect both children and adults. It involves immature myeloid cells, which are precursors of red blood cells, RBCs, platelets, and some types of WBCs. These cells grow quickly and prevent the normal blood cells from functioning. Chronic myeloid leukemia. This type of leukemia mainly affects adults. It involves mature myeloid cells that grow slowly and gradually increase in number in the blood and bone marrow. The exact causes of leukemia are not known, but some factors may increase the risk of developing it, such as genetic mutations or chromosomal abnormalities in the blood cells, family history of leukemia, exposure to certain chemicals or radiation, previous treatment with chemotherapy or radiation therapy for another cancer, having a genetic disorder such as Down syndrome. The symptoms of leukemia vary depending on the type and stage of the disease, but some common signs include fever or chills, fatigue or weakness, frequent or severe infections, bleeding or bruising easily, swollen lymph nodes, spleen or liver, weight loss, bone or joint pain, night sweats, skin rashes or red spots. The diagnosis of leukemia is based on physical examination, blood tests, bone marrow biopsy, and sometimes other tests such as genetic tests, imaging tests, or lumbar puncture. The treatment of leukemia depends on the type, stage, age, and overall health of the patient, but it may include chemotherapy. This is the use of drugs that kill cancer cells or stop them from dividing. Chemotherapy can be given orally, intravenously, or intrathecally into the spinal fluid. Radiation therapy. This is the use of high-energy rays or particles that damage cancer cells or prevent them from growing. Radiation therapy can be given externally or internally through radioactive implants. Stem cell transplantation. This is a procedure that replaces the diseased bone marrow with healthy stem cells from a donor or from the patient's own body. The stem cells can be collected from the blood or bone marrow before or after chemotherapy or radiation therapy. Targeted therapy. This is a newer type of treatment that uses drugs that target specific molecules or genes that are involved in the growth or survival of cancer cells. Targeted therapy can be given orally or intravenously. Immunotherapy. This is a type of treatment that uses substances that stimulate or enhance the immune system's ability to fight cancer cells. Immunotherapy can be given intravenously or subcutaneously. The prognosis of leukemia depends on many factors such as the type, stage, response to treatment, and complications. Some types of leukemia have a better outlook than others, and some patients may achieve remission or cure with treatment. However, leukemia can also relapse or become resistant to treatment, requiring further interventions. Leukemia is a serious and life-threatening disease that requires prompt diagnosis and treatment. If you have any symptoms or risk factors for leukemia, you should consult your doctor as soon as possible. Thanks for watching.